Central American Medical Outreach, CAMO, is on the brink of an exciting new chapter, empowering tomorrow, sustainable health and education for Honduras. Honduras is one of the poorest countries in the Western Hemisphere, with widespread malnutrition, low levels of education, illiteracy, and poor health services. Over half the population lives in poverty, and the public healthcare system is severely under-resourced. CAMO has been addressing these critical needs, but our headquarters in Santa Rosa de Capon, built in 2003, is no longer sufficient. Originally designed to house 5 offices and the warehouse, now it is also providing medical care. The space struggles to support our expanded operations. Our warehouse, which stores and distributes over $2.7 million worth of donated medical supplies annually, takes up 66% of our space, leaving limited room for our growing number of clinics and services. Our robust educational program presently has to rent space for our educational classes and workshops. Our offices, originally built for a maximum of 20 employees, now hold over 60. We are bursting at the seams. CAMO has been a beacon of hope and health for the people of Honduras for nearly 3 decades. The dedication of Honduran doctors and nurses who selflessly volunteer despite the heartbreaking conditions of their country's healthcare system is a testament to the power of compassion. They generously give their time 1 day a week in CAMO's clinics, providing crucial care to impoverished populations in need. Today, we are launching a plan to secure the future growth of CAMO for the next 30 years. This plan aims to address the urgent need for expanded facilities to continue our mission of providing sustainable health, hope, and education for Honduras. To address these challenges, CAMO is launching a capital campaign, Empowering Tomorrow, Sustainable Health, and Education for Honduras. Our goal is to raise $2 million to expand our facilities in 3 phases. Phase 1 is the construction of a new warehouse and distribution center from 2025 to 2026. The new warehouse sits on a 1.47-acre plot of land generously donated by attorney Ramon Flores. This new facility will be 4 times larger. This structure will allow for secure parking and maintenance of our fleet of vehicles, with loading docks for coordination of dispatch of supplies. Flanking this area is the prosthetic lab for the fabrication of prosthetic components and for fitting the patients with orthotics and prosthetics needs. Connected to the prosthetics lab is the wheelchair repair shop, fitting for the wheelchair and space for inventory of donated chairs. The other 2/3 of the space will be used for medical supplies and equipment. The space will include our biomedical department. We presently distribute medical supplies and equipment to 86 public and charitable institutions per year. Phase 2 is the conversion of the current warehouse into medical clinics from 2026 to 2027. We will convert the warehouse above our offices into 2 floors. The first floor will house our medical department, and the second floor will house our educational department. The facility entrance will feature a cafeteria offering coffee and healthy food for patients, staff, and passerbys. The medical department will have 11 clinics. The front 4 clinics will be multi-specialty, allowing volunteer physicians to rotate through them. Specialties include neurology, OB/GYN, gastroenterology, endocrinology, dermatology, counseling, and ENT. The waiting room will be shared by the dental, ultrasound, procedure, and radiology departments. The dental clinic will have 3 chairs, a lab, and panoramic X-ray capabilities. The ultrasound room will enhance prenatal care and provide diagnostic services for abdominal evaluations. The procedure room will improve our care for patients with wounds, especially those in the diabetic foot clinic, and for cervical cancer diagnosis and treatment. It will also accommodate other minor procedures not requiring general anesthesia. The radiology department will feature a digital system with general x-ray, a reading room, and mammography. The mammography section will include a changing room for patient privacy. Development of an educational and training center, 2027 to 2028. Above the medical department, we will build the educational department. The third floor will house all of our educational training and generate a revenue stream. This will include CAMO's National Training Center for the American Heart Association, which provides CPR and advanced life support certification. This will be a center for continuing education courses for medical professionals, soft skills, workshops for the literacy program, along with courses to complement our partnerships. It will lend itself to events allowing a rental income. Preparing for the next 30 years, we have made provisions for the future by adding office space that will allow many opportunities and will enable growth of our educational and medical services. Every day, children and adults come to our doors seeking help. Christian, who was only 2 years old when we first met him, and Jose, who was just 4. We supported them throughout their adolescence, and now they are thriving young adults. Don Manuel, a farmer, had been blind for 2 years due to severe cataracts. He frequently ran into gates because of his condition. We were able to perform surgery on him the next day. His vision was restored, allowing him to read and regain the freedom to care for himself and his family, as evident by the smile on his face. Our new facilities will enable us to create even more success stories like these. By expanding our services, we can dramatically increase the number of patients we serve and improve the quality of care. Our goal is to shorten the waiting time for appointments, partner with more Honduran professionals, and provide a wider range of medical specialties. We are already making great strides towards our goal. Land has been donated and pledges totaling $800,000 have been secured. The total project cost is estimated at $2 million. We are grateful to all of our donors to date, including attorney Ramon Flores for the donation of the land, the Home Builders Association of Wayne and Holmes County for the home project, Guerra and Associates for the architectural designs, Noble Foundation, and our USA Board President Ron Taggart for the large initial donations. We invite you to join us in this transformative campaign. It will significantly enhance our ability to provide top-quality medical services and education to our community. Your support in this campaign will help us realize this vision and continue to improve the health and well-being of those we serve well into the future. Together, we can make a lasting impact.